I think it will work because of the strength of the data that Dr. Goodenowe and others have, and some of our recent data have shown that there is a consistent association between reduced levels of plasmalogens and on the one hand, and a number of measures of neurodegeneration on the other. The animal data showing that it can reverse some of the consequences in some of these animal models, and the notion that peroxisomes, or at least that we know plasmalogens decrease with increasing age, and that the notion that that's a risk factor for Alzheimer's disease, where we might be able to intervene and prevent that from occurring.
Yeah.
Stem that natural tendency, and we need to develop some more data in that area, but I think it's a very compelling hypothesis based on the data that's available and based on the simplicity of the approach.
That's the I was thinking. Like really, the real power of the program is how simple it is. Okay, it's really not a complicated. Like we're not dealing with a complicated protein or complicated protein-protein interactions. The hypothesis is very simple. The body already has these plasmalogens in its membranes. Clearly, the body clearly has a mechanism of making and transporting and installing plasmalogens in the membranes. So those mechanisms are already there and functioning, presumably. And all we're doing is supplying the molecule that the liver normally makes. And so from a hypothesis perspective, it doesn't get much simpler than that.
Mm-hmm.
And so the simplicity of the hypothesis is in terms of its likelihood of success. It's also good because we'll know right away if it doesn't work because it's such a simple hypothesis.
Mm-hmm. And because we have the tools to measure the effects on, starting from the initial effect on lipids in the blood, as well as the downstream effects on cognition and brain structure.